It's here. You can start.
Okay, I'm Dr. Sarani from Pakistan. I graduated from Peshawar Medical University and I worked in both rural and urban clinics and hospitals. My message for medical students, I put a quote here. The chapter you are learning today is going to save someone's life tomorrow. Pay attention, but yes, don't forget yourself. Next slide, please. I'm going to present mononucleosis, which is also called infectious mononucleosis, and it is also known as kissing disease. It's a contagious infection which is caused by a herpes virus called Epstein-Barr, and some other viruses can also cause this condition. And the infection is common among teenagers and young adults. Why it is called kissing disease? Because it transmits through saliva. That's why it is called kissing disease. So let's talk about the main symptoms. I divided into three stages. First is the prodrome phase, which usually lasts 3 to 5 days. And in this stage, patient may present with fatigue, uncomfortable, loss of appetite, and sore throat. It is followed by an acute phase, which is usually presents with swelling of the lymph nodes, exhaustion, headaches, swelling of the liver, spleen, and sometimes rash. And the last stage is the recovering stage, which is the convalescence phase, and usually patient starts to recover. It may last 3 to 6 months, and main symptoms resolved at this point. But yes, patient may feel fatigue and weak. During this time, if the patient has inflamed and enlarged spleen, they should avoid contact sport because it is a high chance of a splenic rupture. And the next is how to diagnose mononucleosis. It usually depends on the reported symptoms and like fatigue, fever, sore throat, lymphadenopathy, rash. But yes, diagnosis can be confirmed with some blood test, which includes lymphocytosis and the others. In symptoms, you can see the lymphadenopathy, which is the swelling of the gland mostly around the neck, and you can see the rash, which is maculopapular rash. It is a generalized, non-itchy rash. It started from the trunk and upper arms, extended involve the face and forearms. If we're talking about the screening test, we have a monospot test in which we detect the heterophil antibodies in the blood of the patient. Antibodies appear during and after an infection with the virus that cause mononucleosis. If we are talking about the treatment, so there is no specific medications or vaccination that can prevent or stop this condition. But there are some things that can help in recovery, which is the rest and the hydration and some over-the-counter medications and prescribed medications. But if there's a severe case, so it is a patient may take or doctor may prescribe the corticosteroids. So if we are talking about the prevention, so as I already told that it is transmitted through saliva. So the best ways to prevent mononucleosis is just not share your drink or food and personal items. Practice good hygiene, proper hand washing, and make sure don't share body fluids which doesn't have a mononucleosis. So the last thing is, if we talk about the complication of infectious mononucleosis, the most common one is a splenic rupture, which usually happen in the recovery stage because of the inflammation. So other thing is kidney inflammation and jaundice, liver failure, hemolytic anemia, encephalitis, meningitis. It also involves the heart, which can cause myocarditis, heart rhythm problems, and it can also obstruct the upper airways because of the inflammation, swelling of the lymph nodes, pleural effusion, and also cause the peritonsillar abscess. It can also cause some long effects, which can cause lymphomas, including the Burkitt's and Hodgkin. The patient might have increased risk of developing autoimmune diseases like multiple sclerosis, and also it can cause it transmits from acute to chronic active Epstein-Barr infection. So thank you so much and good luck.
Excellent. Thank you, doctor. So, excellent. We go to the next doctor, who is okay. Who is next?